Hello again. For those of you who are watching this live through live streaming, I understand that there have been some difficulties. Thank you, President Kathy Finninger, for pointing that out to us. This show will be posted again at a later time if you're still experiencing those difficulties, but we're going to go ahead and restart the show. I want to welcome you to our COVID-19 talk with the local health authorities. My name is Stephen Williams, Director of the Houston Health Department. I have Dr. David Persse with me from the City of Houston and Dr. Umair Shah from Harris County. Starting over again with the first question. Now you can be more concise, Dr. Shah. Methodist Hospital analysis of genetic makeup of infections in Houston indicates a strain that has mutated to become more contagious. Your thoughts?
Yeah, concerning. Obviously, we know that there is going to be a lot of changes that we've seen globally, and we know that. We're also concerned that there are going to be changes that are going to be understood here locally. And the question is really going to be how significant of a change this is. Is it just a change in the genetic makeup, or really does it have a change on how the virus operates? And we just don't know. So we're watching this very closely.
I agree with what he said.
I understand that folks are still having difficulties. We're going to go ahead and tape the show, but we will broadcast it live later on Facebook. The protocol is expected to change for City Hall meetings now that a council person tested positive. Taking temperatures was mentioned as a possibility. Should all buildings and employers do that?
Well, we are recommending that that people protect their workforce and protect their customers. And a good way to do that is, as we have in many city buildings already, and it'll be expanded even more, is when people come in, they're asked the questions about how are you feeling, and you know, fever, any symptoms, and taking temperature. Now, one of the rate limiting steps for a lot of places has been the ability to get a thermometer, which has been a no-touch thermometer, which has been a challenge. But nevertheless, I think that's a good practice. It allows the employer or the business owner to have some regulation as to who comes into the building. We do expect and hope that the public will be cooperative with this. In other words, if you show up someplace and they don't want to let you in because you have a fever, or you've had some symptoms that are concerning, you need to respect that and respect the fact that you may be contagious, and go and take care of yourself. Get a hold of your doctor, go home, isolate, whatever. But yeah, I think it's a good practice. And not only that, it's part of the new normal that we need to move towards, right? Mm-hmm. Everybody wants the economy to get up and going again, so we need to define what the new normal is. This is probably going to be part of the new normal.
People are waiting, what is happening to deal with increasing the intake capacity for testing and to deal with the underserved communities?
Well, both of our communities are doing a lot to get more testing sites out into more neighborhoods. And in most of those cases, they're not like the big places we have today that are doing 500 a day. So these are going to be in the 100 a day range, but into multiple neighborhoods, and they're going to be moving around. So if they're not in your neighborhood yet, hang on, we'll probably get there. But they're being posted on social media, the city websites, both of our websites have it, and the schedule as well.
Yeah, it's the same thing for us. What I think the key is that we recognize not everybody can go to these two FEMA sites that we have, the two FEMA sites the city has, is that we want to make sure that transportation is pulled off the equation. So that's the reason why putting these in where people are living, or going to work in communities, and moving them around allows us to really recognize that, that taking that off the table. So I think that's absolutely the key. The second piece of this, which I think is the first part of the question, was how do we increase testing throughout? And I think that as the technologies continue to improve and the availability of those tests continue to improve, we're going to start to see more and more in the community, not just with government, but also with other folks in the community.
I'm really glad that you mentioned that, because there are a number of provider groups that are testing their own patients. The criteria might be different, but they're still testing their patients when they believe that it's indicated.
That's right.
Well, the other thing I was going to add is that where the test sites, at least for the city, and I'm sure for the county as well, where they're being located is not random. We've actually looked at accessibility. We've looked at the risk of folks having the long-standing illness, the underlying illnesses, and also health equity. And so it's all part of an equation, and so they're not completely random.
That's right.
So
That's right.
it's actually a targeted, strategic deployment strategy.
And our tests are free, and so that's, I think, the other thing that we have to remember is that you may be going to a private sector somewhere else where they may be charging something, but at least there's some assurance that when they come to our sites that they're not going to be charged. And they're quick. So I think that's the other thing is I've talked about is that, a lot of people are saying, well, I'm not going to go stand in line. These are not long lines. These are 15, 20, 30 minutes and you're out. And
So I'll tell you, I went and I got tested myself recently because I'm walking the talk. We're telling people to go get tested, and so I went and I got tested. And it was useful not only to find out whether or not I was an asymptomatic spreader, but it was also useful because I went through the entire process, right? So I called in the morning and I got my number. I did it on a Saturday because I know that we tend not to hit the 500, and so I purposely went on Saturday because I didn't want to take a test away from anyone else. And so it was this past Saturday, and we had Officer Knox's funeral. And so following that, I went. So I got to Butler at around maybe 2:15 in the afternoon. And if I was on the property 5 minutes, I'm exaggerating. Wow. You mentioned that it was quick. It was very quick, and it was very simple. It was not painful at all. It was easy peasy. Got on, did it. People were really nice, and no issues at all.
Yeah.
Yes, we're monitoring the activity at those sites, and usually around 2, 3, 4 o'clock in the afternoon at major sites, they're not very, very busy at all. So we just encourage people to take advantage of that opportunity to get tested. From a viewer, I was recently at a local hospital for major surgery. They followed all the protocols for making sure I was not positive for COVID, but no medical person near me had on a mask. These hospitals are spending millions of dollars on various technologies, but shouldn't all staff wear protective devices?
I mean, that's disappointing. I'll be honest. I don't know which hospital that was. If we knew that we would actually have a discussion with them, because that is disappointing.
Actually, I know, and I'll tell you later.
Yeah, please do. Please do, because that is disappointing, and that's not what we're saying. And obviously, we're telling the public the same thing. Wear cloth facial coverings. We're obviously wanting to make sure that that's happening within a hospital system.
Yeah. If we want everything to go back, right? We're not going to go back. I think people need to get it out of their head about going back. It's moving forward. And so healthcare professionals in particular need to be the role models about how we're going to move forward and learn how to get society going again, get the economy going, and all those things, and at the same time behave in a way and have strategies in place to minimize the spread of the virus. So disappointing is an understatement. That's really.
I have a question for you on that one. So let's we got into that perfect world where you could get to daily testing, like you had your healthcare, the personnel daily getting tested. Does that change the equation about how if people are daily basis testing negative, and what are your thoughts there?
It does a lot, because right now we're still in a mitigation phase, which means we're trying to minimize the damage, right? We're not really, we are focusing on trying to slow down and stop the virus, but we're simultaneously trying to minimize the damage because it's so widespread. When we get to a point, if we could, with the daily testing and reporting, then we could move quickly into a containment stage, which would, as you know, that is when we would have the opportunity to stop the virus, like we did with the Egyptian river cruise. So we would need to get to the point with daily, easy, inexpensive, with automated reporting to be able to achieve that. If we can get that, then we can. That's a game changer.
Yeah, right, exactly.
You're watching our COVID-19 update with local health authorities. We'll be right back in a few minutes.
Talk amongst it.
sing this song. Wash, washy, wash, washy, wash, wash. Rub your hands and fingers and the places in between. Using soap and water makes your blood so clean. Wash your hands. Great job, you're almost done. 5, 4, 3, 2, 1.
Taking care of yourself is also taking care of others. We are all in this together.
How does the 2020 census affect representation? There are 435 seats in the House of Representatives. These get distributed to the 50 states by population, and an accurate census response helps your state get the right amount of seats. States with smaller populations get at least one, while states with larger populations might get more. Shape your future. Start here. Visit 2020census.gov.
Welcome back to our COVID-19 talk with local health authorities. Going to jump back in again. There's a question, well, actually a couple related to opening back up, and I'm just going to shorten it a little bit. Is the county or the state using scientific evidence for guidance regarding opening back up?
Yeah, you know, I think we want to remind the viewers what we talked about a while back, that it wasn't just about, we talk a lot about the science of medicine, the art of medicine. Mm-hmm. This is not just the science of public health, but it's actually the art of public health. And there are incredibly important ramifications of decision making, whichever decision you make on both sides, right? You reopen too quickly, oh, there's a public health issue there. You don't reopen, there are other costs that are involved in that. So we are at the county, and I know at the city, looking at, and we've continued to look at a number of different factors that bring the art into the decision making, which includes science, but it also includes what are other pieces of information when you don't have all the evidence and you're trying to make the best decision you can. I'm hopeful that that's happening at all levels of government, whether it's at the local, state, and federal level. Unfortunately, we've seen across the country that's not always the case. And so we're trying to do the best we can to be guided by science, but bring the art of decision making on the public health side at the table. But the answer is yes, we have numbers. We're looking at the cases in the community. We're looking at how much testing is in the community. We're looking at the hospitalizations. We're looking at how saturated the emergency departments or the hospitals, the intensive care units, the ventilator usage. All of those are part of that equation of science. But then we have to make a decision based on all that information.
So David, the mayor said that we might be moving a little too quickly, reopening up the economy. Does the city or the county have any plans to slow things down to keep everyone safe? Or is the pressure too great to return to work?
Well, I don't know that the city or the county have the power to slow things down. I'm not a lawyer, but my understanding is that the governor is basically taking that power away from local government. So I don't know if they have the power to. Now, that doesn't mean that the local government is powerless, right? They may not be able to execute an order, but that doesn't mean that they're powerless. So we continue to try to influence the way people behave and how businesses practice and so on and so forth by, educating folks with the science that you talked about earlier. And to that point, the notion when the governor first came out with his order was that we would look at things for about 2 weeks and then based on that make a decision. So that's why it was 18 days. And I've been a little bit uncomfortable with that 18-day period. I think it's way too short, right? But from what I'm seeing is I have not seen the numbers going down. I'm plateau, if anything, at this point. So I'm concerned that we're moving too fast.
Right. Yeah, and I would just add to it is that just because a business can open doesn't mean they must open. And just because a patron or a customer can go into a business doesn't mean they should go into a business. And we've talked about those who are over the age of 65 with chronic health conditions. We're still saying, hey, you really should only go out if you absolutely have to, because we want to make sure that we're protecting you. Social distancing, physical distancing. I know, David, you've been using that term as well. You're the one who really wanted to champion that physical distancing of 6 feet or more, cloth facial coverings, as well as doing our best to obviously not be around anybody when we're sick.
Right.
Okay, kind of related to that, even with masks on, we're hearing that recirculated air in small spaces, e.g. offices, restaurants, even with social distancing when involving extended exposure, say 90 minutes at a restaurant, can lead to virus infection. Is this something that folks should be worried about?
Yeah, I think I think that the answer to that question is yes. So if we look at flu, because this virus is new, and let me say what I've said before, this virus seems to be breaking every rule. So take what I'm about to say with a grain of salt. But even with flu, we know that, you generally have to have a certain number of viruses that get to you before one of them is going to actually get through the maze of everything and infect you, right? So it's, in the fire service, we talk about time, distance, and shielding. And that's mostly when we're talking about like, radioactive sort of events and things like that, time, distance, shielding. But same thing applies here. So if you're in a restaurant and nobody's wearing masks and there's a lot of density, so people are nearby, there's a much greater chance that the one infected person that may be in the restaurant, that over time even if you're X number of feet away, that enough virus is going to flow through that you're going to get it. Now if it's a short period, or if the distance is great, or if somebody's wearing a mask, that risk goes way down. But in the absence of time, distance, and shielding, yeah, your risk goes up, and people need to pay attention to that. They need to calculate that. To your point, if it doesn't look like a safe environment to go into, don't go into it.
Yeah. Yeah.
Based on what's happening in Wuhan, China, with cases resurfacing after they appear to be contained, in addition to social distancing, what else should we do, and what impact does air conditioning systems have on its spread?
Well,
same thing?
Yeah,
I think it's basically the same thing.
Yeah, same thing. But I will say that it does concern us anywhere in the country or the globe when we start to see this concern for reemergence. We don't know what's happening, and the concern is that, oh gosh, has there been a mutation? Are some of the measures not working? Is the immune system, the immunity waning? There's a lot of things that come into play, but we're concerned about any of those reports.
Yeah, and we talked about earlier this week. We talked about at one of the mayor's conference about this. It was just a single case report, but it was an individual in South Korea, and so South Korea had done a great job. They got huge amounts of testing, and they had closed down society, and they had a pretty good handle on things. And they decided to open things up, and so they opened up the clubs and the bars one week in early May. So it was just a couple weeks ago, and there was one person who on the following Wednesday was symptomatic and tested positive. So they did their contact tracing, and they found out that he had been in 3 clubs the previous either Friday or Saturday night. So from those contacts, they identified 50 people that he apparently had infected. 50 people that he had apparently infected. And now they're doing the contact tracing on those folks. And the thing that it was, in the scientific journal, the Wall Street Journal, and in the New York Times, those 2 scientific journals. But anyways, they talked about the Koreans are estimating there's about 7,200 folks were in the clubs that he was in that night. And now they're trying to connect with all of them. So it just goes to the point that it doesn't take a lot to set all the dominoes in motion. Now, a club is probably worse than a cruise ship.
That's right.
Lots of people close together, singing, dancing, drinking, hugging. It's probably if you're a virus, that's where you want to be.
David, is this like from experience? I mean,
Yeah, I've seen this in movies.
You did the move. Like
I saw that in a
Yeah,
movie.
but he was a little stiff. All right, let's move on. In retrospect, is Sweden's approach to the COVID-19 outbreak preferable to the U.S. response? If not, why? What are the merits of the Swedish government's response?
Well, I think a lot of governments have looked at all sorts of different ways to respond. New Zealand is one that really comes to mind right now as being very successful. The Swedish approach has been really trying to not lock down or close down and sort of let the virus go through. But if you look at their rates, and including their hospitalizations and deaths, compared to the other Scandinavian countries, they've actually had higher rates. So is that preferable? I don't know. I mean, that's what I think all of us are going to be looking at down the road. But I will say that there is no right answer to any of this, because this is uncharted territory.
It's only going to, my opinion is it would only be beneficial if the immunity is long lasting. Because if it's not, if the immunity is short lasting, it's like just constantly setting your house on fire. It burns, and as soon as you rebuild it, you burn it again, right? So if immunity isn't going to be long lasting, then I think there's a huge flaw in that theory.
Yeah.
Okay, have we flattened the curve in the county and the city? Yes or no?
Yes. Again, reopening brings up the dynamic of we've done a fantastic job as a community. Where are we going to be in a short order as people start to remix?
Yeah, I think there's 2 things. One is that we probably have flattened the curve, and if you look at our number of new cases and so on and so forth, the healthcare community has done a great job of making capacity available, and so we need to thank them for that. So we've been successful there, but we're not winning. We're flat.
Okay, thank you for watching our COVID-19 talk with local health authorities. We'll be back in just a minute.
You have to stay home.
Not just to protect yourself, but to protect others.
Stay at least 6 feet away from other people. 2, arm's length. Just because you're at home
Doesn't mean that we can't be alone together.
How do you protect yourself and others from coronavirus?
Avoid touching your eyes, your nose, and your mouth.
Wash your hands often with soap and water for 20+ seconds.
Clean and disinfect surfaces and objects.
Together, we can help slow the spread.
Respond to the upcoming 2020 Census survey online, by phone, or by mail. A complete count of all Houstonians helps our city secure federal dollars for roads, schools, healthcare, housing, and disaster recovery. By answering just 9 questions, your voice will help shape how Houston is represented by state and federal officials over the next 10 years. The census is easy and everyone counts. Your responses are safe and confidential. For more information, please visit 2020census.gov.
With coronavirus spreading, people at higher risk must take extra precautions. You are at higher risk if you're over 65 or if you have an underlying medical condition like heart disease, chronic lung disease, diabetes, or if your immune system is compromised for any reason. If you're at higher risk, stay 6 feet or 2 arm lengths away from others. Better yet, stay home if you can. The choices you make are critical. Please visit coronavirus.gov for more information.
Wash, washy, wash, washy, wash, wash your hands. Scrub them while you sing this song. Wash, washy, wash, washy, wash, wash. Rub your hands and fingers and the places in between. Using soap and water makes your hands so clean. Wash your hands. Great job, you're almost done. 5, 4, 3, 2, 1, now dry.
Wash your hands for 20 seconds, just like Elmo.
Welcome back to our COVID-19 talk with our local health authorities. This is sponsored by the Rotary Club of Houston. How long will we need to put off conferences and athletic events?
I think for months. I think it's going to be a long time. Or we have to figure out a way to have those and for it to be safe for people to attend or to view it. But
what is the best way to disinfect face masks for reuse?
Well, the cloth coverings that you can, obviously you can hand wash them, so that's the way to do it. But the face masks really depends on what kinds they are, and certainly the reusable versus single use, I mean, that just adds a lot of complexity. Yeah. I want to go back to the sports question, which is, it's not just about the people that are watching, it's also about the athletes.
Yeah.
My company wants me to go into the office, but I can actually work from home. My boss said it isn't fair to give me specialized treatment when the rest of the employees have to physically be at work. What can I say to them to convince them to keep me safe?
Well,
think about the community.
Yeah.
Think about the community. We're all in this together. We have to rely on everybody making good decisions for the entirety of our community.
Yeah.
You might not have an answer for this, but Bill Gates predicted a potential epidemic as a threat in 2015. We tend to ignore threats we perceive as impossible. Beach parties have not stopped. Many families seem to be gathering again. How do we restrain impulses of bulletproof?
You know, that's difficult. You know, Peter Hotez says that is a self-resolving problem, and what he means by that is that if the wheels come off and things get bad enough, every family will have experienced the downside to that, so that they will then change their behavior eventually. But at this point, all we can do is try to educate people.
Yeah, and I think from the Bill Gates standpoint, I would just say that it's not just Bill Gates. I mean, there are a lot of people that have said, Lori Garrett is the one that comes to mind, who have said that this is something that was of concern. We're going to have a lot of armchair quarterbacking when this is done. And in fact, we've already had it about what could have been, what could have, should have, would have. But, you know, obviously we're in the midst of the pandemic now.
We're now 3 months into this pandemic. What is the best case and worst case for outcomes?
Well, the best case is somehow it flares out and we go back to normal and we're all happy and we take these cloth facial coverings off and we're you know, it's blue sky. The worst case scenario is that this continues, we ping pong all the way through a vaccine. The vaccine maybe 12 months, 18 months down the road, and we're having to contain the best we can, but we're going to just have all these outbreaks and clusters, opening, closing, and reshuffling, all sorts of things that'll be just this bad scenario all the way down until a vaccine comes in.
I'm going to one up your worst case scenario. The worst case scenario would be we see another mutation which makes this virus more lethal, yet maintains its easy transmissibility.
And we have a hurricane, and the grid goes down, and the vaccine doesn't work. I mean, there are horrific scenarios that come, but we're hopeful that
plausible.
science, and that science and really the good graces of whatever deity you want to go to is that somehow we get some mercy and that we actually get through this.
But part of our responsibilities is to start planning for this.
Yep.
What part of responsibility is what?
Is to start planning for this. You mentioned the hurricane.
Yeah.
We know it's hurricane season, so we have to look at our staffing ratios and everything, and make sure that we have the capacity to respond, because we won't really have a choice.
And mosquito season. I mean, that's another one.
Okay. Dr. Fauci mentioned that the vaccine production will be started in advance of completion of clinical trials. How will we get our fair share here in Houston if the vaccine is actually
I suspect that that's going to be, I suspect that will be regulated by the federal government.
So what is the time frame for that vaccine? I know Fauci gave a prediction. What was it?
So it was 12 to 18 months. At some point 2 Fridays ago, he said that as early as January of 21, but it looks like it's going to be at least a year beyond. So we're May, so it could even be in the summer of 2021. Some people are saying even by 2022.
Okay, even when the state opens up, should we continue to minimize large crowds gathering like weddings?
Yes.
Yes, yes, absolutely.
Older citizens seem to be having a more difficult and stressful time staying in and away from families. How do we keep our sanity?
Yeah, well, we've talked about this is not just, it's really not social distancing, it's really physical distancing. We want to make sure that people are connected spiritually together, emotionally together, and certainly physically apart. So I think it's really about all the strategies for us to check in with our neighbors, our grandparents, our uncles, aunts, et cetera, and making sure that we continue to remind them that they're part of our community.
You know, it's not just the elderly, it's also the kids that are having a hard time.
Yeah, that's right.
Opinion. Should there be stronger ramifications to putting others around you in jeopardy? Your opinion.
Well, I think that whatever we do, it's got to be effective. So we've already seen that if something is comes across as too stringent, that there's a backlash. So part of this is not about what is philosophically right, but what is going to operationally achieve the goal. And so there's got to be a balance. And I don't know if we figured out that balance yet.
Okay, we have about 2 minutes. What can be mandated in nursing homes about testing given the extreme conditions and number of deaths we have seen across the country?
Well, the governor has already made some pronouncements that really allow a lot more, putting nursing homes on notice that their assessment and testing is critical. How that's all going to play out is really what we're working on right now.
Okay, I'm in the real estate business, and clients do not want to view homes in person. Is there any way I can prepare a home for a walkthrough, perhaps spraying or asking the owner to stay out for a certain number of hours?
It's a tough one. I mean, you know, I'll say virtually is the best way, but at some point when you're final stages of a home, I mean, going into that home is probably the way to go. But you know, this is one where I don't have a good answer.
I don't either. No.
Okay. Lastly, how long will we need to put off conferences, athletic events, particularly since it's obvious that Mayor Turner's quick action to shut down the rodeo contributed greatly to Houston's not being in the situation New Orleans is in?
Yeah, I think it's going to be a long time. That's going to be a huge problem. I don't have an answer for that, but it's going to be a long time.
Yeah, and I would say mayor and judge have both been working on that, including with the rodeo. So I think there's a lot that we'll see as this moves forward.
Okay, I want to thank you for tuning in to our COVID-19 talk with our local health authorities, Dr. David Persse from City of Houston, Dr. Umair Shah from Harris County. I want to thank you to the Rotary Club of Houston and President Kathy Fininger for sponsoring this event. I am Stephen Williams, the Director of Houston Health Department. All right, we got